So you're having a baby. Congratulations, and first baby. So you get ready for the ride of your life, and it's a fun ride. So if you're anything like my wife and I'm sure you're really excited, and maybe you're a little nervous. And one of the things you're probably nervous about is the potential of pain associated with labor. So fortunately, I'm here to tell you that there are safe and effective options to manage your labor pain. So labor pain comes from contractions, uterine contractions, and each patient has a different threshold, right, of and different level of pain when they begin to feel these contractions. And so some patients will certainly have different pain management needs from others. So let me help you kind of look at the entire spectrum of treatment options to manage your labor pain. And after learning these options, you can then decide where you fit in, whether you want to do nothing at all and have what people call a natural birth, or have your anesthesiologist sort of intervene and help create a tailored plan for you to manage the labor pain. One thing I have learned over the years is that labor is a very personal experience for patients. So it's my job as an anesthesiologist to present you options, to educate you on risks and benefits, and basically ultimately execute your plan of choice as long as I feel like it's safe for you. So on one end of the spectrum, some patients, they really opt to do nothing at all. They'll simply allow labor to progress, and they opt out of any pain management intervention. Now, many of these patients start by trying to go without pain control, but later they opt back in as labor progresses, and sometimes they can't tolerate those contractions any longer, and then they ask us to intervene. But either way, we'll help you with your labor goals. We want to make sure that you're safe, and we would like to minimize your pain as much as possible. Many patients, they come in with very specific labor plans, breathing techniques, massage therapy, visualization exercises, things like that. These kind of techniques, they require training and practice and preparation. And so you probably want to talk to your OB about those things during your visits while you're pregnant. So first of all, we can obviously give you medicine by mouth, by IV, by an intramuscular fashion. And we call these medicines, these pain medicines, analgesics, okay? Analgesics, they're useful, but they're useful in helping kind of bridge the gap when you're in active labor, to quickly take the edge off, to kind of bridge the gap when your anesthesiologist isn't immediately available. Medicines like Stadol, and they're good at temporarily masking the pain, but they're not good at eliminating the pain throughout the course of labor. So it's not a great option for the entire course of labor. They have side effects and dosing limitations. And so the most common and effective method for pain control during labor is called the epidural. And most people have heard of an epidural, but what is an epidural? So the epidural space, it's a space near your back where we're able to sort of bathe your nerve roots that are responsible for labor pain. And we bathe these nerves with what we call local anesthetics, numbing medication. Same thing dentists give you in your gums. We give you a similar medication near your epidural space, and we bathe those nerves. You should check out anesthesiamyths.com's video on the placement of an epidural. It's fantastic, and it gives you a lot of detail. So once we have it in place, we can continuously give you medicine through your epidural throughout the entire course of labor. It takes about 15 minutes or so to kick in, and then you're able to get continuous medicine throughout your labor. It'll ease the pain during the contractions. You'll probably still feel the pressure of the contractions, but the pain itself should significantly diminish. It's one of the most rewarding things I think anesthesiologists do, is that moment that a pregnant woman in labor starts to feel her epidural kick in, starts to feel comfortable. It's really satisfying to make sure that we've really made an impact on our patient's labor experience. And so in addition to the effective pain control that epidurals offer, one advantage of the epidural is that it's kind of an avenue for us to give you a stronger medicine in the case you would ever proceed to a cesarean section. That means if your baby needs to be delivered surgically, we can use your epidural to give you medicine that'll help anesthetize you from the belly button down, and your baby can be delivered that way. Some of the risks involved now in an epidural: anytime you introduce a needle to skin, there's always a risk of bleeding or infection, and that's why we do evaluations prior to an epidural. Make sure you have low bleeding complication risk factors, as well as do this procedure under a sterile environment. There's a very rare risk of nerve damage, but again, it's very rare, and we're able to do this fairly safely. Those two modalities are very rarely used in controlling pain through labor. Occasionally a spinal can be combined with an epidural if the situation calls for it, but spinal in general, anesthesia are more commonly considered when a patient is having a C-section. So please have a good conversation with your anesthesiologist when you get to the hospital, and let them know your labor goals and what type of intervention you think you may need, and let us help you have a wonderful labor experience. I mean, anesthesiologists play a major role in keeping pregnant women in labor safe and minimizing their pain. So yeah, I hope this information helps and helps you make your decision on your needs for pain management intervention when you're in labor. I'll see you next time.